Assalamu alaikum. Welcome to Dermatology Journal Scan of February 2026. The clinical differences between true and pseudo-Hutchinson sign was discussed this month in the Journal of the American Academy of Dermatology. Hutchinson sign affected more than half the nail, was wider than its longitudinal melanonychia, with discontinuity in pigmentation and non-linear borders, while the pseudo-Hutchinson sign had a linear border with proximal pigment fading and a confined west in relation to its longitudinal melanonychia. This next study was very interesting, where daily foot immersion in saturated saline cleared 98% of warts after 8 weeks with tolerable side effects. The mechanism for this therapeutic effect may be through antimicrobial peptide upregulation and an increased vulnerability of human papilloma virus-infected keratinocytes. In the next article, it was proposed that in Sweet syndrome, interleukin-36 is upregulated and induces neutrophil activation, net formation, and netosis, rationalizing the anti-IL-36 spezilimumab as a new therapeutic approach for Sweet syndrome. In the following study, it is recalled that morphea can be associated with several comorbid conditions, the most common of which is thyroid disease, particularly autoimmune thyroiditis. Autoimmune skin diseases like psoriasis, vitiligo, lichen planus was also reported, but the most common was lichen sclerosus eatrophicus. Less commonly, autoimmune rheumatic diseases were found to be associated with morphea, like systemic lupus erythematosus, systemic sclerosis, but most commonly was rheumatoid arthritis. In 15% of patients, there was an associated malignancy, with breast cancer being the most common. In this article, Chris Griffiths et al. Stressed the importance of early intervention with biologics for patients with psoriasis, as this may have a higher possibility for complete resolution of psoriasis, better response rate, and improvement in subclinical joint inflammation. In the next research, we see the benefits of adding zinc supplementation to our treatment regimens for elderly patients with bullous pemphigoid, as zinc may reduce skin fragility and improve renal functions. In the Journal of Investigative Dermatology, aryl hydrocarbon receptors were found to be downregulated in vitiligo, resulting in increased levels of interferon gamma and cell cytotoxicity to melanocytes. This article in the European Academy of Dermatology demonstrates the value of hematopoietic stem cell transplant for advanced stage MF and Sézary syndrome. An article in the Dermatology and Therapy Journal discusses the benefits and risks of bariatric surgery on the skin. Armstrong et al. Demonstrated the benefits of deucravacitinib, an oral tyrosine kinase 2 inhibitor, even after failure of apremilast in patients with plaque psoriasis.